or three that I'm sure we all want to take off from. And after about 20 minutes of that small short forum, we're going to open the field for your questions. Many of you have already advanced the questions, no? And we have them on a good file here. But we're still opening up the discussion to more questions as we go along. And you can actually send those questions via the chat here, right? You may also Viber if you have the Viber numbers of the organizers, sila Gian, sila Agi. Yeah, just spread the word, and we'll try as best we can to have your questions aired and answered by our experts here. Okay, let's begin. But first, we introduce. All right, our special guests for today are Dr. Nino Dayanghirang from the World Health Organization, and he's coming to us live from Addis Ababa in Ethiopia. So talagang thank you so much, Doc, for taking time to join us today. Our other guest is Dr. David Flavier. As you know, for those of you who watch 1PH or tune in to Radio 5, he is the host of Clinica Flavier. And of course, needless to say, yan, he's the son of the famous. Let's do it. Okay, Dr. Juan Flavier. Yan. And then also we have Dr. Ted Herbosa from the National Task Force on COVID-19.
From Quezon.
All right. From Quezon City, live from Quezon City. Okay. All right. We'll start with a very, very basic question for each one of you to answer. And this is your chance to really promote the vaccine rollout of the government. The very basic question is this: why do we have to get vaccinated? How important is it? We'll start with you, Dr. Herbosa.
Thank you, Luchi, and good afternoon to everyone at the Metro Pacific Group, and thank you for this kind invitation. You know, in public health, there were two great inventions. The first great invention was potable drinking water. When people were able to filter water, remove the bacteria and the microbes from it, and gave it to people, there were less diseases. The second great invention happened about 300 years ago when a doctor decided to find a cure for smallpox. Smallpox was a very bad illness. Dr. Jenner decided to get cowpox and inject it, scratch it into some kids, and they became immune and protected from smallpox. And from then on, we've had this program of vaccination, the single most important public health activity there is. So if there's anything your government will do for you, it's going to be to vaccinate all of you and prevent death and illness due to all these diseases that can be prevented by vaccine. So with that said, we now are in a pandemic. The pandemic is new. The virus is new. The coronavirus that's causing COVID-19. But it's also interesting that for the first time in the history of mankind, we were able to develop vaccines in a span of a year, in less than a year. In 9 months, I think, the vaccines were being rolled out and given to millions. Before, it took decades, 10 years, 10 years or more to get people vaccinated. So with that said, I think there's a lot of hope. In fact, the problem is really getting the vaccine to our arms. Many of the other countries that produce vaccines and have money to buy vaccines are cornering the market. So it's really a big help if we can get it as soon as possible. And you should be happy, people in the Metro Pacific Group, because your corporation decided to purchase it on its own vaccines for all of you. So I think that's one very important thing to note, that they took effort to purchase it ahead of time, way ahead of the government, way back in November with the Go Negosyo Group, and then sooner again with the Moderna Group. So I think it's very important that the people use this opportunity that your corporation did for all of you. Thank you, Luchi. Back to you.
Okay, thank you, Dr. Herbosa. That was interesting. Now, just taking off from your answer, maybe we can ask the next question also to Dr. Dayanghirang. Now, of course, Dr. Herbosa said that, well, let's just say the phenomenal thing about the vaccines for COVID is that they were formulated in less than a year. But that also happens to be one of the scariest things about this vaccine, right? I mean, ang alam naming lahat, yung mga vaccines took years and years to develop and to be tried and tested. But here we are, we're being asked to, diba, to put forward our arms for a jab of a vaccine that has been only tried for less than a year by only so many people. Dr. Dayanghirang, can you enlighten us on why this should not be a scary thing to do?
Thank you po, Ms. Luchi, and thanks, Doc Ted, dun sa introduction po on why it's very important to get vaccinated. On regards dun sa safety naman, on the process of development of the vaccine and of course the manufacturing, as Doc Ted said, the manufacturing process, it's really well known. For example, smallpox, it's one of the only diseases that we were able to eradicate from the world. So we used vaccines to do it. So it's a known technology. It's fairly safe. We have a lot of systems in place to check after administration of that vaccine, and of course, even during the manufacturing process. So when it comes to the safety of the current vaccines that we have right now for COVID-19, even though the development was quite fast, as you know, the development was fast because we really needed the vaccine at this point in time, because it's one of the best measures in order to prevent sickness and death from COVID-19. So when we think about the sickness and in death from COVID-19, the vaccine is a more viable option to make sure that we don't get to those outcomes. With regards to the safety of the vaccine, we have to make, we're quite sure that it went through a very rigorous and stringent process. So usually po, when it comes to vaccines and other health technologies, before it goes to any arm or any patient, it goes to stringent regulatory authorities. So for example, if I remember correctly, the first one who was able to launch it was England or Great Britain. They had a stringent regulatory authority that really looked into how the manufacturing was, what was the data and information gathered from various studies on the safety first of the vaccine, even before the efficacy. So when it comes to safety, it's always safety first. It's always first do no harm to the patient. So with those processes, especially coming from reputable manufacturers and reputable institutions, we're fairly sure that it's safe, especially when it comes from these reputable agencies, and of course from known stringent regulatory authorities. So for example, in our situation in the Philippines, we have our National Regulatory Agency as well, and of course we ascribe to that. Kung ano po yung sinabi ng ating regulatory agency, if it's safe, we try to adhere to the safety measures. And of course, when it comes to, for example, dun po sa regulatory agency na unsure po tayo, we have a network of other regulatory agencies to help support the information that we have, to make sure that the information on the safety is of paramount importance before even we go into effectiveness. So in a long way, it's just trying to give you some buffer po that the vaccine is quite safe, especially if it comes from if it gets the nod from our regulatory agency and from the experience of other countries as well. So hope that answers the questions. Thanks, Ms. Luchi. Back to you.
Thank you, Dr. Dayanghirang. Yes, it did answer the question, but it also raised a few more questions, and I'm hoping that Dr. Flavier can help us also here. No, as you know, there's so much information going out there, and they are pretty conflicting. I'm sure you will agree with me, no? And there are anti-vaxxers to deal with, okay? But there are also conspiracy theorists, and then there are also other doctors who are neither anti-vaxxers nor conspiracy theorists, but who also have, let's just say, legitimate and also expert claims about the vaccines. And while vaccines have been with us for the longest time, we will grant that there are vaccines that use a very new technology, specifically the mRNA. And that alone raises a lot of questions as to what the effects of that would be long term. So maybe Dr. John D, maybe you can enlighten us on the information going around, what to believe, what not to believe, what to throw away outright, and what to munch on and consider seriously.
Totoo po yan, Boss Luchi, kasi nakakagulo nga, kasi nag-aaway eh. Hindi pa nga tapos ang gamot, hindi pa tapos ang pinag-aawayan na.
Yeah.
Pero babalik ko ako sa sinabi ni Dr. Ted at ni Dr. Nino na ang COVID vaccine po, baliktad. Dahil ho sa pagkakaisa. Kami ho sa 1PH at saka sa TV at Radyo 5, palagi namin dinidiin na pinagkakaisang Pilipinas ang mahalaga. Ang COVID vaccine ho, nakakatuwa na nagkakaisa mga gumagawa. Halimbawa, yung sikreto, yung kodigo ng paggawa ng bakuna laban sa COVID-19, galing ho sa China yan, binuksan nila ang buong kodigo at nalaman ng buong mundo. Dahil doon, sabay-sabay na gumawa, ang bilis ng paggawa. So, imbis na nagsosolo ang isang kumpanya na makakatest sa 10 tao o 5 tao, ito libo-libo kagad na sabay-sabay na tetest. Kaya ang bilis. Dahil sa pagkakaisa ng karamihan, ang bilis ho ng proseso. Hindi ho kakaya dati, kompetensya kasi. Kaya ayaw mo ibigay, ayaw mo ipamahagi sa iba kung ano nalalaman mo. So napagkabagal ang proseso. So yung unang punto ho, dahil sa pagkakaisa, bumilis ang proseso ng pagkagawa ng gamot. Pero yun din ho yung problema natin dahil sa wala pang gamot na tunay. Bakuna pa lang ho ito. At dahil wala pang gamot na sigurado na, merong ilan lumalabas, pinag-aawayan pa, napakahalaga ho ng bakuna dahil sa proseso ng pagkakaisang protection. Kung ako lang at si Ted ang magpabakuna, si Dr. Nino hindi pa yata nakakakuha ng libreng bakuna nila, hindi pa ho kumpleto ang magiging proseso. Kasi kung nasa isang kwarto tayo, 5 lang ang may bakuna, yung 5 wala, pwede pang makahawa at magkahawaan. Kaya kahit sa pagpapabakuna, napakahalaga ho ng pakikiisa. At ang realidad ho sa Pilipinas lalo, ang dami pang tinatamaan ng COVID-19. Ang sakit ho niyan, kasi yung unang solusyon na binigay ay nasa ating mga kamay. Magsuot ng mask, magsuot ng face shield, maghugas ng kamay at panatiling malinis ang ating sarili, magdistansya hanggat maaari, at kung pwede nga, lahat nun nasa ating kakayahan. So napipikon ako pag sinasabi ang media ang may kasalanan, hindi sinasabi sa amin ang tama. Si Ted at gobyerno ang may kasalanan dahil sa hindi nila ginagawa ang tama, o kaya si Dino ang may kasalanan kasi hindi libre lahat ng gamot. Ang totoo niyan, karamihan sa atin ang may kakayahan dahil sa nasa ating kamay ang solusyon. At ngayon, sabi nga ni Dr. Ted, dapat nasa ating braso na rin ang solusyon. At yan ho yung bakuna laban dito sa pandemya. At bilang huling punto po, Ma'am Luchi, huwag naman nating kalimutan na medyo nahirapan ho tayo sa kampanya ng pagpabakuna. Wala pa ang COVID-19, medyo bumaba na ang pagpabakuna. Noon kasi si Secretary Flavier, inspirado sa mga kagaya ni Ma'am Luchi at saka tinutulungan ng kapatid ni Dr. Ted, ang taas ng pagbakuna noon, halos 90%. Tama, Dr. Nino? Yung bilang halos 90% eh. Eh nitong nagdaan, pinag-awayan kung ano-anong mga bakuna, nagtakutan, bumaba na ho sa 30%. So medyo malaki ang kalaban, hindi lang ho yung pagbalik ng tiwala sa COVID-19, kailangan pa rin ibalik ang pagtiwala sa kahalagahan ng pagpapabakuna.
Alright. Well, maganda na sinabi mo na nagpaturok ka na. So tanungin ko na rin, ano ba naramdaman mo nung nagpaturok ka? Gusto na yung malaman, syempre.
Siguro Ma'am Luchi, simulan ko doon sa aking na-obserbahan. Napakalaki pa rin. Ano ho to kami lahat ay mga manggagamot, health worker na sabay-sabay nagpaturok. Pero tinitignan ko sa linya, ang dami pa rin hong kakaba-kaba. Nanginginig yung kamay.
Even among health workers, no?
Hindi mapakali. Sa amin mismo. So totoo na nakakakaba dahil sa may mga hindi tayo alam o tinakot tayo. Pangalawa, ewan ko kung naobserbahan din to ni Dr. Nino at ni Dr. Ted, at tumaas ang side effect na increased blood pressure. Kadalasan na pagka hypersensitivity, decreased blood pressure ho eh. Pero dahil nga sa takot sa atin, sa kaso natin, ang naobserbahan namin, tumaas ang blood pressure. So yung unang nakita ko sa karanasan ko, Ma'am Luchi, may kaba pa rin na dapat mapaliwanag para maalis yung kabadong yan. Sa akin po, dahil nga yung bakuna na kuha ko ay gumagawa ng panlaban sa kamay, pagtusok ko nung binakuna sa akin, gumawa ng panlaban, medyo sumakit yung braso ko.
Tense
at,
kayo, tense.
Yan, at naramdaman ko yung parang trangkaso, pero hindi naman ako linagnat, hindi naman ako nabaldado. Kaya swabe lang po ang epekto sa akin at pasalamat ako na nakuha ko yun na libre po.
Okay. Stress lang yon. Okay, Dr. Ted, kayo naman, kayo rin, nagpaturok na kayo. And I'm sure, foremost in the minds of many now, is the question as to sino ba ang pwedeng magpaturok at dapat magpaturok?
Well, tama, nagpaturok na rin ako, no? Ang maganda nga, sinalubong namin yung mga bakuna nung dumating sila sa airport.
Oo nga pala. Welcome party pala kayo.
Party. Yeah. Excited na ako. At the following day, dumating siya February 28, the following day, sa PGH, yung unang bakunahan. At ang unang binakunahan ay yung director, si Dr. Legaspi. Ako naman, nakalista rin ako, so nagpabakuna na rin ako kasama ni Dr. Salbanya, Dr. Eric Domingo. At sa awa ng Diyos, nung hapon nilagnat ako, trangkaso ako. Sabi ko, uy, hindi siya distilled water kasi donated lang eh. Baka fake. So, hindi naman. So, nagkaroon ng immune response. So, happy ako. Sabi ko, uy, uminom lang ako ng paracetamol the following day. Siyempre, okay na the following day. Walang, hindi masakit din yung injection site and everything. So, it's the same thing na sinasabi natin when we tell parents that bring their children for vaccination, lalagnatin po yung anak nyo. It's actually not a side effect. It's the effect we want to see. Pero siyempre, sa patients, they feel that it is an adverse event. Nilagnat sila, parang tinanangkasa sila. Ako nga, parang may sore throat pa eh. Yung pakiramdam talaga yung bago ka bumagsak sa trangkaso. That was the feeling. So, that's what everybody should feel. And if that happens, it's actually good. If it doesn't happen, it doesn't mean hindi nagkaroon ng immune response. Pwede pa rin nag-produce ka ng antibody, pero hindi as strong as what happened to John D. and myself. So yan ang maganda, na-realize ko, uy, bakuna talaga yung in-inject sa akin kasi nag-react yung body ko. So yung sa reaction, of course, nung una nga akala ko magpo-protest pa yung mga tao kasi made in China yung dinala sa PGH. Sabi nila,
oo nga eh.
Hirap. Maharap kami sa mga COVID patient. Pagkatapos, ang ibibigay nyo sa amin, hindi yung Pfizer at hindi yung Astra, yung Sinovac made in China. Wala naman, kinulang pa nga yung bakuna on that same day. Kasi on the first day, ceremonial lang, 125 doses lang. Pinauwi pa yung iba kasi yung iba had to come back the next day where we did all the vaccine. So, that was good. Kasi nung nag-survey kami the day before, Sunday, town hall, 30% lang ang gusto magpabakuna sa made in China. Pero nung vaccination day on March 1, lampas 125 yung gusto magpabakuna. So which is good. And then after that, nag-change na. I think it was good that people saw the doctors and the hospital directors getting vaccinated. Si Dr. Herbosa nagpabakuna. Naniwala na yung iba, nagpabakuna na rin sila.
Oo, talagang syempre kayo mga model eh. dapat talaga tumindi ka. Mauna kayo, kumbaga, mauna kayo at papanoorin namin.
Correct. Mauna kayo.
Right.
Kanyo.
Right. Okay, and last question before we open the field, no? Dr. Nino, tanong ko lang, although hindi ka pa nagpapabakuna, pero para lang to manage expectations, ika nga, no? Ano ba talaga ang ginagawa ng bakuna? Kasi akala ng tao, pagka nabakunahan ka na, pwede ka nang maglalabas at okay ka na at hindi ka na mahahawa. I think that we have to lay the groundwork for what people need to still keep in mind even though they get themselves vaccinated. Dr. Nino?
Thank you po, Ms. Luchi. Thank you, Dr. and Doc John D. So from our experience po with regards to vaccines, specifically dito po sa COVID-19 vaccine, based on the studies po, napakita na yung vaccines were efficacious and effective at reducing the risk in a certain population po for for serious morbidities or serious sickness or even death. So nung nakita po on a certain population that's a controlled environment, so hindi siya on a general population, nung ginawa po yung study, nakita na kapag yung hinati po yung population na yun sa dalawang parts, yung isa, yung binakunahan, yung isa hindi binakunahan. So nakita po dun sa study na yun, for certain vaccine candidates at that time, na yung mga nabakunahan, mas mababa po yung nangyari sa kanila as a group na nagkaroon ng malubhang sakit o mga namatay. So with that information in mind, hopefully with the intervention po as a public health intervention ng vaccine program, that is what we're trying to see in the population right now. Doon po sa mga binabakunahan natin ngayon. So simply po, katulad po na sinabi ni Doc Ted kanina, nagkakaroon po ng parang ng immune response, parang tinitrain po yung katawan natin para maging ready po tayo, yung katawan natin sa paglaban po dun sa pagdating ng COVID-19 infection sa atin. We're not really quite sure if it would be effective on a certain population because we're trying to get real world data right now, but we're hopeful based on our previous experiences from other vaccines. But what was I saying? Okay, so ang nangyari po, so hindi po ibig sabihin na kapag nabakunahan kayo, pwede na kayong maglalabas, pwede na po tigilan yung pagsa-social distancing, yung pag-frequent hand washing or hand hygiene. So it doesn't mean you should stop those non-pharmacological measures to prevent COVID-19. So pagdating po sa infection prevention and control, it's a lot of different practices and behaviors. So kasama po dyan yung pag-vaccinate po ng sarili natin, kasama po dyan yung pag-maintain ng social distancing 1 to 2 meters to ensure that we're not transmitting the virus. At kasama po dyan yung frequent hand hygiene. And of course, kasama rin po dyan yung pananatili ng mabuting pangangatawan or a healthy lifestyle po. Thank you.
So thank you, Dr. Nino. So in short, just to be clear about this, hindi ko mo na bakunahan na ay hindi na mahahawa. Para lang klaro.
Tama
no?
po.
Ang
Klaro
pinipigilan ng bakuna ay yung ma-hospital ka dahil lumala masyado yung yung sakit mo, no? Lalo na mamatay ka, no? I think that should be made clear. Yan, para klaro sa lahat. At ngayon,
and
kailangan
we should still
natin
maintain po yung ma'am.
Yes,
and we should still maintain social distancing and yung frequent hygiene and all other things that we were doing even before we got the vaccine po.
Okay, great. Yeah. Okay, I think that's going to be our new permanent normal, really, no? The masks and the social distancing, at least for a while, no? Pero sana matigil na yung lockdown. Okay, having said that, eto na. Let's entertain or read out the questions that have been texted to us or posted in the chat. Okay. I'm going to try my best to really read as many of the questions as I can. Okay. First question, general theme on questions, vaccine safety related ko ito. Ano po ang advice ninyo? And anyone can answer this, no? Ano po ang advice ninyo pagdating po sa mga taong may comorbidity? Halimbawa, yung pinaka-common, no, ay of course hypertension o high blood, no? Diabetes, yan. Cancer, mga allergies sa mga ibuprofen or paracetamol or kahit na anong allergies pa yan. Safe ba for them to take the vaccine? Who would like to answer that?
I can answer that.
Yeah, Dr. Ted.
People with allergy, I just hope i-declare nyo to sa maraming steps kasi yung vaccination site. There'll be a registration place, you register, tapos there'll be an assessment, there'll be a physician, kakausapin kayo, i-declare nyo na allergic kayo sa mga ibang gamot, tatanungin naman yon. Pero sabihin nyo may allergy kayo, huwag nyo pong itago yon. Mas ang hinahanap nila ay kung may allergy kayo sa mga dating bakuna, sa ibang bakuna na naibigay na sa inyo, yung mga flu vaccine or whatever. Kasi yung mga ginagamit na inactive incipients, yun kung minsan na nagpo-cause ng allergy. Hindi yung virus talaga na nandoon sa bakuna. So kung nag-allergy ka sa previous, baka mag-allergy ka din dito. So babantayan ka naman nila. So hindi yun magiging kontra sa pagbabakuna. They will still give your vaccine, pero they will observe you. And of course, ready sila sa yung kanilang pang-anti-allergy, yung epinephrine, in case magkaroon ka ng reaction. So they won't send you home. 15 to 30 minutes, babantayan ka nila and they can send you home. At kahit na pinauwi ka na, there are some that have a delayed allergic reaction, which after 24 hours, kailangan bumalik ka rin sa emergency room at sabihin may nararamdaman ka. So, very important lang alam natin na pwede kang magka-allergic reaction kung may history ka ng allergy sa iba't ibang bagay, pagkain, etc.
All right, thank you, Dr. Ted. This question is from Luisa Katapang. What if some of your family members are already vaccinated, but the others are not? How safe will it be to be living with them in the same house? Dr. John D, care to answer?
Yeah, I actually typed my answer to her na. Pero yes, as the panel has already emphasized, because the vaccination process is still ongoing and many are still unvaccinated, it's very, very important for us to continue safety precautions and hygiene practices. So even with one or just two of your household vaccinated, all of us should still continue to wear face masks and shields, hand washing and hygiene, physical distancing, and avoiding crowded places as often as possible.
Okay. All right. Here's a question from Miendrada Ramos. We were told that the vaccines that PLDT purchased were AstraZeneca and Moderna. We have reported cases of AstraZeneca having very severe adverse effects. Filipino OFWs who had their second dose went into coma for more than a week after having been vaccinated. Is there a specific group that should take a specific COVID vaccine? Can you explain what may have happened there? Anybody? Dr. Nino, Dr. Ted? Any comment on that? Actually, that's been in the news, no? Yung AstraZeneca. Yes.
Adverse reactions, Luchi, but you know, all vaccines, all medicines have some reactions. There will really be some people that will react to the vaccine, but the incidence of this is very low. Hindi siya i-approve ng regulatory agencies for emergency use authorization if they find data na mataas ang adverse event. So, yung risk benefit nito napakalayo. So talagang safe siya. Hindi siya, remember all the vaccines being given today and even the ones purchased by the Metro Pacific Group, they are still on phase 3 or they are still experimental vaccines. They have not completed phase 3 of experimentation. They are in phase 3. But because their interim effects are so good and the side effects are so low, countries decided to use them with an emergency use authorization. And that's why Metro Pacific has bought these vaccines, I think Moderna and Astra. So they work differently, but both of them have been used widely for millions and hundreds of millions of people na yata ang nabigyan na nito. And of course, hindi ko i-deny na merong mga nagka-reaction. And ang chances na ikaw yung magka-reaction na yun is actually very low. And that's why there's an assessment. I-assess kayo ng doctor nyo kung ano ang risk mo, at doon nila babantayan kanila kung sasabihin nila, sige, magpabakuna ka. And we have what are called deferrals. In the vaccine sites, the doctor can defer your vaccination. So don't get frustrated, no? Even if you listed up, and then suddenly the doctor in the vaccine area can say, we'll defer you, not today, maybe some other time, di ba? Maybe because of several reasons. That's part of the assessment of the physician. That's for your safety. So meron kaming tinatawag na deferrals. We will defer your vaccination to a time wherein you're probably healthier or safer. Yun. So we will
Nino, you were,
do everything to make the vaccination safe for you. And I'm sure Metro Pacific will do the same for all its employees. Yeah.
Yes. Dr. Nino, you've been nodding your head vigorously since this question was asked. No, would you care to add to that? Kasi nasa balita nga yung AstraZeneca causing thrombosis or blood clots. No, should we be alarmed by this?
Hi, Miss Luchi, and thank you so much to Doc Ted. I was nodding vigorously kasi nga po, tama po yung sinasabi ni Doc Ted. With regards to dun sa risk po or adversary, yung sa risk of having what do you call this, of having adverse events or side effects, it's quite low as what we know from previous vaccination programs. It's just that nang nangyari po yata kasi ngayon, if you look at it at the data po on the Philippines and in other countries, as you know, medyo lumalaki po yung mga tao. So yung non-communicable diseases, it's a big problem po. Yung epidemia rin po ng non-communicable diseases, dito na po natin nakikita yung interplay po ng lahat ng mga problema po natin sa public health pagdating po sa pangangatawan ng mga tao. So
by non-communicable, you mean yung mga heart disease, halimbawa, yung mga hindi naman nakakahawa pero ang dami ng ganun ngayon, no? Yung mga may high blood, etc.
Yes, ma'am. Yeah. Na undiagnosed and uncontrolled. So so nagkakaroon po ng pagkakataon na yung mga safe na health technologies like yung vaccines, ini-implement natin through public health programs, pero nandun po yung underlying conditions po ng mga tao. Na for example, if you look at the news, especially dun sa European countries that closed their specific vaccination programs using AstraZeneca or that vaccine that was reported to be causing those concerns. If you look at the population po, it's those populations at risk po talaga for that kind of diseases, yung mga thrombosis, yung nag-heart attack, nagbe-brain attack. So perhaps po, nandun na po yung interplay ng non-communicable diseases na hindi po nakokontrol. So as Doc Ted said, so parang rhyme, na dapat po we're at a good health, and if as much as possible the best health when we try to get the vaccine. The doctors will be there to help assess your fitness in taking the vaccine, and there will be deferrals. But as Doc Ted said, don't be disheartened, wag po kayong mag-alala. They're just trying to make it really safe for you to take the vaccine. As he said, there are a lot of different, for example, points in the line kung kailan po from the decision that you're going to take the vaccine to your scheduling to eventually getting it on your arm. And after that, meron pa rin pong safety measures. Yung post-vaccination, yung i-check po kung nagkaroon po kayo ng adverse events and all those things. So on that regard po, dun po sa pag-monitor namin or surveillance after the fact na nagkaroon kayo ng vaccination, maliit lang po yung nakikita namin mga reported cases of adverse events, because we look at it as in totality, not just in a specific country, but all the reports po, it comes to us. Then we try to assess what's the risk of this certain health technology or vaccine or medication in terms of the risk, relative risk. And of course, doon po sa risk na magkakaroon kayo ng other events aside from the known risk of taking the vaccine. So it's best, of course, to tell your doctor everything to make sure that you're in good health when you take the vaccine. And of course, afterwards, you try to assess yourself if there's a lot of different things that might be wrong with you. If you feel funny, you can also report that as one of the possible effects of the vaccine towards you.
All right. Salamat po, Dr. Nino. Dr. John D, ito tanong para sa iyo. If you are already a COVID survivor, kailangan ka pa bang magpabakuna?
Okay. Mainly because hindi pa ho natin kabisado ang COVID-19. Ang punto ko doon, hindi natin kabisado kung gaano katagal tumatagal ang protection ng bakuna mismo at pati yung nagkasakit na. So sa madaling salita ho, dahil hindi tayo sigurado dyan, sinasabi pa rin namin na maganda pa rin magpabakuna, nagbibigay lang tayo ng palugit. Ang gusto ng DOH siguro mga 90 days after the documentation of infection bago kayo magpabakuna po.
Okay, tapos kaakibat niya, no? Pwede raw bang yung first dose ay isang brand tapos yung second dose iba? Or kunyari daw if the local government has vaccine A and PLDT will provide vaccine B, can they have two different vaccines? Is that safe?
Okay. Sa safety po, safe naman, pero yung pero ang importante. Sinasabi ho namin kasi, pareho naman ang target . Nagkataon ho, lahat ho naman yan, ang target yung protina ng spike protein o yung sungay at tinik ng bakuna ng COVID-19. Kaya pare-pareho ang tinatamaan. Pero iba-iba yung timpla. So kumbaga sa timpla, sinimula mo na sa 3-in-1 tapos lilipat ka sa sobrang asukal, medyo delikado yung balanse. So sa madaling
hindi advisable.
Hindi ho advisable, pero ang sinabi niyo ho, meron siya nakuha na isa, sa susunod wala nang dadating at hindi siya empleyado ng MVP na may libreng stock. Desperation na ho yun. Hindi ho abiso yun na gawin.
Okay. Ito naman, Dr. Ted, ito marami nagtatanong. Kung paano po yung mga seniors? Meron daw, may isa dito, yung mother niya, 97 years old na, no? Tapos alam din natin na yung Sinovac is not for senior citizens. So paano nga ho ba yun solusyonan? First, is it safe? Is it safe for seniors? Well, we know that already because actually niro-roll out na yung vaccines for seniors sa LGU, no? But is it safe? And how safe for really very, old people like in their 90s and above?
Well, as I said, no, the safe answer to that question is most of these new vaccines are still experimental. So bagong-bago pa ho siya. So ang knowledge natin sa kanila is limited to the fact of how it's been used sa people. So if you've heard nangyari sa Norway, in Norway, nagkaroon ng injections dun sa mga home for the aged, yung elderly shelters nila, and tumaas yung parang mortality. So the Norwegian government lowered the vaccination to 80 yata, binaba nila sa 80 kasi nakita nila although hindi pa found na causal, no, yung ibig sabihin hindi dahil sa bakuna. Nagkakataon lang ang matatanda pag 98 ka na, kahit anong gawin mo today, baka bukas tapos na end of the line. Pero hindi dahil sa binakunahan ka the day before. So yun yung problema natin dun sa interpretation niyan, no? So yung mga very old, may risk siya. Some sinasabi nga, masyado na namang maedad yan, but po-protect ko pa sa bakuna. So merong ethical issue na yun. But we still do not know. But normally, if they are safe for young people, it should be safe for the elderly. Yung Sinovac, ang sinasabi lang ng FDA ng Philippines is that they have no data yet for the use of Sinovac above the age of 59. But Sinovac has been used in 17 countries, and I think 14 of them used it for people above 60. In fact, ako po, 62 ako. Pero I chose to get the Sinovac. So nag-sign lang ako ng waiver. But I will not recommend that because I can analyze the data personally. Doktor ako eh. Educated ako. I read the articles, I read the safety profiles, but I cannot give that recommendation to the others. Kasi that's the risk I did for myself. And luckily, hindi naman ako namatay. Nabuhay naman ako, tsaka mukhang may immune response ako. I can have my antibodies checked and I probably have antibodies. So, it's going to be safe. Now, ang question natin, naubos yung AstraZeneca.
O yun na nga eh. Yes, sir.
So, nasabi ngayon ng aming vaccine expert panel, we have a vaccine expert panel, nadinig ko sila sa TV this morning, sinasabi nila na in this situation na wala namang ibang choice, it may be safe to actually give the senior citizens the Sinovac. So I'll wait for the NITAG to concur. Meron kasi tayong NITAG. Yung NITAG naman is the National Immunization Technical Advisory Group. At sila ay sumusunod din sa parang may NITAG din yung WHO. Nag-ano lang sila, nag-a-align lang sila ng sinasabi. Kasi ina-analyze nila yung datos sa buong mundo sa lahat ng paggamit nito. So hintayin lang natin. Ang feeling ko, i-approve ito if they will allow the use of the vaccine, especially because of the delay of the delivery of AstraZeneca. Niloloko ko nga si Dr. Dayanghirang. Sabi ko, madaliin mo naman yung AstraZeneca na pinaраmis ng COVAX para mabigyan na yung mga...
Oo nga eh. Na-delay pa eh.
Pedros.
Diba?
Oo.
Naunsyame.
Pwede po. And then yung sa very old, pag-usapan nyo with your physician kasi may risk-benefit na dapat pag-usapan.
Alright. Dr. Dayanghirang, may tanong po rito from David Neil Narvaez. There's news that the efficacy rating of Sinovac is only like 70%. Actually, nung una nga, 50% lang nga or something, no? Compared to others like Moderna and Astra. So if one has been injected with Sinovac earlier on, since that's the only available vaccine then, no, can he still be given Astra or Moderna later? If yes, how soon?
Okay, thanks, Ms. Luchi. So that's a lot of questions in one question po. So I'll try to answer po the first one regarding po dun sa yung
sa efficacy. Anong masasabi niyo ron niya na mababa
yes,
lang daw?
Yes, ma'am. So yung sa work ko po talaga sa WHO before is on service delivery, specifically on empowering patients. So from my side, on that particular work po, dapat po talagang mas empowered po yung patient. So it's good that everybody's reading up on these vaccines. But they have to be also well-informed enough to know that lahat po ng mga katulad po na nasabi natin kanina, may mga studies po na ginawa bawat vaccine na yan. Ang problema po, mahirap po i-compare bawat study. There's a different format or a different way on how to compare those studies. So, ang sinet po ng WHO na standard for vaccine efficacy trials to be accommodated or to be eligible, for example, for emergency use is that it should have at that study at least 50% vaccine efficacy. So it's the same standard po that we use for Ebola, for measles, for what's the other? Ebola, and for example, schistosomiasis and malaria. So basta maka 50% vaccine efficacy po, it can go to national regulatory agencies or stringent regulatory agencies to try to assess. The country will try to assess po if it's something specifically po dun sa risk-benefit ratio po na kung mas maganda pang gamitin itong mga vaccines na to, even though at studies po of vaccine efficacy, it shows that it's at 50% or slightly above. So when we compare the vaccines po, and we have to understand, these are studies po, so it's very controlled population, very controlled environment. So in a manner of speaking, it's an experiment. So right now po, we're having this big experiment with real world data through our vaccine programs against COVID-19. So as data comes in, we're trying to assess to see if the vaccine effectiveness is enough to try to to try to limit the number of infections from COVID-19. So the more people, the more experience that we get from the vaccines, the better. Now, on the second part of the question with regards to serial vaccination, for example, you get vaccinated with a
Yes.
certain type of vaccine first, and then
Yes.
afterwards you get vaccine from another company or another manufacturer. Currently po, there's no studies, but from the essence po, or from the theories po, that the vaccines are safe. So as we manufacture and develop vaccines, the most important thing is that we keep it safe first before we check for efficacy and effectiveness. So in essence, there should be no issues, but we currently do not have any information kasi nga po limited po ang stocks ng vaccines. So at the end po, one of the actions that we really need to do is that we try to get the vaccine that is available to us. So that's the best vaccine. Ang sagot po is the one that is available to us. So if it's the one being procured by the MVP group or by the government, if it's available to you, if you're in line to receive it, get it as soon as possible. Because nandun din po yung issue as we progress along this course of vaccination, nandun po yung SF drugs or SF vaccines, tinatawag na substandard and falsified vaccines. So aside dun sa adverse events, this is one of the biggest issues that we're tackling right now, yung pagkakaroon po ng mga substandards na vaccines o yung mga vaccines na sinasabing may effect pero wala naman talaga kasi mapangit po yung pagkakagawa nila or falsified. Katulad po yung takot ni Doc Ted kanina na baka distilled water lang yung binibigay sa kanila. And this is linked to the criminality involved with these health technologies and medications. So it's important that we get it from reputable sources like the government and of course from the company as well. And if it's procured ethically and reputably through a good supply chain management. So as we know, there's a supply issue right now. So there's a lot of opportunistic people out there that might try to take opportunity of the situation. So in a long way, it's good that the patient is empowered. They know a lot of things about the vaccine through the vaccine studies, but be careful in comparing. And then number two, try to get the vaccine that's available to you right now to make sure that it's of course not substandard and not falsified. Thank you, Ms. Luchi.
Ms. Luchi,
Thank
may
you,
I ask
Ken.
to that?
Yes, please, Dr. John Digo. Yeah, I was going to ask you nga how to overcome this, alam mo yun, this non-preference for Sinovac, considering that it will likely be Sinovac that will be supplied to the Philippines more than any other brand. I think that's how it looks now.
It's accessible. So I'll start with what Dr. Nino was saying. The best vaccine is the one you can get in your arm the soonest. Sabi din ni Dr. Ted yan. Kasi medyo gipit yung supply eh. Kaya kung anong una nyong makukuha, pasalamat tayo at nakakuha kayo. Ngayon sa tanong ni Ma'am Luchi, yung una ho, Sinovac, yan ang talagang na-test na ng ilang dekada. Centuries nga, sabi ni Dr. Ted eh. Kasi yung proseso at yung prinsipyo sa Sinovac, yun yung pinahinang klase ng virus
Version
at yun
ng
ang
virus.
ipapasok. So talagang ang karanasan dyan ay napakatagal na. So sigurado na tayo dyan. Swerte ang MVP group of companies kasi ang balita ko, Moderna ang ibibigay sa inyong isa. Ayan yung medyo mas bago at kung tama yung sinasabi sa medical journals, meron pang gagawin na booster ang Moderna. Booster para sa mga lumalabas na variant. Kaya halos swerte na empleyado kayo ng MVP group of companies dahil dyan. Pero ganun pa man, yung ibang makakakuha ng AstraZeneca, hindi din dapat mag-alinlangan. Paano ko ba sinasabi ito? Marami nagte-text sa akin na text lang ang tanong. Pero yung dinidiin ko, protection ho ang kailangan natin. So hindi ho kailangang batalyon ng sundalo ang makuha natin sa ating barangay. Sa ating barangay tama na yung 3 sundalo at 3 pulis. Pwede na. So ganun din ho yung bakuna. Hindi natin kailangan yung 100% effective na armado at may mga tangke. Yung mga nagbabantay na pulis ay mahalaga na. Basta yung pulis na yan, meron silang mga litrato na magnanakaw at kawatan, mahuhuli nila yung mga masasamang loob. Pangalawa, hindi lang ho pulis ang nangyayari dyan. May pulis na papasok, yung bakuna ay pulis, pero yung pulis na yan ay hihila ng mga tanod. Magpapatulong sila sa tanod. So yun na nangyayari. Yung effectivity, kokonti ang pulis, pero may hinihila pang iba na bahagi din ng immune response ng katawan na makakatulong. At yung pinakamahalaga sa lahat, hindi naman ho yung hindi tayo mga magka-COVID ang ating pangunahing gusto mangyari. Ang gusto natin, walang mamatay sa COVID. At kahit ano sa mga bakunang andyan, bumababa ng halos 100% ang pagkakataon na mamatay ang magka-infeksyon. Kahit magka-infeksyon siya, hindi naman siya mamamatay.
Alright, maraming salamat. Okay, here's a controversial question right now. Marami nagtatanong, can ivermectin replace the protection of vaccines? Dr. Ted, na alam ko nakangiti ka dyan, tsaka taga National Task Force ka. Sagutin mo ito.
Ivermectin. Ang ivermectin ay isang gamot para sa bulate. Yung river
Blindness.
for blindness, tsaka stropholoides at tsaka scabies. And it's very effective. In fact, yung mga naka-invento niya nanalo ng Nobel Prize in Science, in Medicine. Kasi nga yung efficacy niya. Gamit na gamit po yan. And for many years, ivermectin was registered in our Philippine FDA until 2018. Noong 2018 po, hindi na ni-renew ng Merck. Merck po ang gumagawa niyan. Hindi niya ni-renew. So ang naiwan po ay yung ivermectin na para sa hayop. Veterinary grade ivermectin. Now, meron tayong isang doktor or grupo ng mga doktor na nabasa yung mga studies nitong isang Australian na ginawa niya sa Petri dish at isa pang ibang mga doktor sa Florida, mga critical care specialist sila. At mga sikat silang doktor. Sabi nila, effective daw to at ginagamit nila sa kanilang mga patients. However, yung ibang doktor, nung binasa naman yung research nila, hindi maganda yung study design nila. Kasi parang testimonial lang. So meron pa nga tayo, dating Senate President, uminom siya on video. Pinakita niya, uminom siya ng ivermectin sa Pilipinas. Para sa hayop siguro yun. So ang problema natin, pinahinto ni FDA Director General ang pag-issue ng ivermectin because illegal siya. Gusto ko man siyang ireseta, bawal po sa aming mga doktor magreseta ng gamot na hindi rehistrado. Kasi hindi ko alam kung paano siya manufacture. Ngayon, itong isang doktor, si Dr. Landrito, sabi niya, kino-compound ko yan. Para sa kaalaman ng mga nanonood, matagal na pong pinagbawal sa physician ang mag-compound. Ang pwede na lang pong mag-compound ay isang licensed pharmacist. Ano ibig sabihin ng pag-compound? Kagawa ko ng reseta, nakalagay doon yung ingredients, papatimpla ko sa isang pharmacist. Pinagbawal na po yan. Nung araw, nung bata pa ako, pupunta ako sa kapitbahay kong doktor. Siya ang gumagawa ng concoction. Siya nagko-compound nung i-inject sa buttocks ko. Hindi ko alam kung anong mga hinalo niya doon. Pero ganun yun. Pinagbawal na po yan. So we have the FDA that registers drugs. Now, effective ba, ang haba nung paliwanag ko, no? Effective ba yung ivermectin? Hindi po natin alam. Kasi nga wala pang datos. Baka effective kasi there are 70 ongoing randomized controlled clinical trials. What are these? These are studies that are better designed. Much better than what the claimants are saying. And once ma-prove yun, na talagang may effect, pwede tayong gumamit ng ivermectin kasi mura siya. Parang 35 pesos lang isang tablet, tapos once a week. Kung may sakit ka naman, parang twice in a week, pwede mong inumin. At yun ang claim ng mga nagsasabing effective. Pero hindi pa ho robust yung datos. So ako ay isa sa mga doktor na nagsasabing, maghihintay ako, ilang buwan lang yan, matatapos na yan. Parang yung hydroxychloroquine last year. Sabi ng mga Chinese doctor, magaling yung hydroxychloroquine. Pero nung inaral siya ng randomized trial, talagang tapatan, walang bias, hindi pala, no effect pala siya. So wala nang gumagamit ng hydroxychloroquine. So wag tayong magmadali, no? Madaming mga politician kasi pinipilit eh. Pinitwist niya yung arm ng regulatory agency dahil congressman siya. Mamimigay daw siya. Congressman, sabi, hintayin na lang natin. Well, what's happening now is I have some friends na nirehistro uli ang ivermectin. Pwede po yun. Irerehistro uli sa FDA at pag binigyan ng FDA ng registration for bulate, bahala si physician if he wants to do what is called an off-label prescription. Irereseta niya yon, bibilin sa butika yon, yung ivermectin. At kung ininom niya, ang mananagot po kung may nangyari dun sa pasyente na uminom ng ivermectin, si doktor na nag-license nun outside the indication. Yun ang tinatawag na off-label use. So, yun ang hope niyan. If people want to take it, kasi yung mga lahat ng pati kamag-anak ko, lahat dyan sa Ayala Alabang, umiinom na lahat yan. At nag-aaway.
Sikat na sikat eh.
Sa kanila, huwag niyong inumin yan. Pinakita sa akin yung botelya. Walang lot number, walang manufacturing date, walang expiry date. Malay ko ba kung anong laman yan, kung ivermectin talaga. So yun yung isang problema natin. You see, your FDA is there to protect you. We are not trying to make money out of this as claimed by these politicians na iniipit daw kasi mas may pera sa bakuna at dun sa remdesivir na 12,000 per vial. Ito, that's the job of the regulatory agency to protect people na hindi tayo basta inom ng kahit ano. So yun yung storya ko sa ivermectin. Magagalit sa akin yung kaibigan ko si Dr. Iggy Dairit kasi proponent ko sa ivermectin. Pero yan ang view ko eh. That's my personal view as an expert. I will wait for more robust evidence if it does work. Ang pinakamadaming gumagamit ng ivermectin sa Brazil. Saan ba pinakamadaming kaso ngayon? Second most number of cases in Brazil. So, tanong ko sa inyo, tumatala ba sa Brazil? Parang hindi eh. So, yan ang tingin ko dyan. That's my personal view. Wala pa akong ano, but I will wait and my mind is open. If it works, ako mismo iinom din ako on TV, on camera, kung talagang may evidence.
Sige, abangan namin yan, Dr. Ted. Okay. Okay, tanong ni Arvin Santos, will there be an adverse effect if you are not vaccinated on your scheduled second dose? Let's say there were delays or out of stock yung vaccine supposedly for your second dose. Will the first vaccine be still effective? Dr. Nino, yes, go ahead, please. Dr. Dayanghirang. Yeah.
So usually po, when it comes to medicines and vaccines, we try to use what the manufacturer's indications are. So for example, pag sinabi po nilang 7 days, 14 days, 28 days, or some specific duration of time between the first dose and second dose, we try to adhere to that. So what happens po, for example, when we have supply constraints, like we're having right now, or what we saw from some countries, like for example, Great Britain at that time, was that they chose with their experts to increase yung duration po between the first and second dose. There are some what do you call this? You have to look, yes, mamimili kung ano yung magandang makakahinatnan dun sa population na gusto nyo po. So nandun po lalabas po yung mga experts kung ano po yung katulad po na sinabi ni Dr. Ted, yung NITAG, sila po magde-decide. And then we follow po because we want it to be a collaborative and a comprehensive process na lahat tayo ay on the same process po na walang may iwan. Kunyari po, yung first dose nyo, after a certain time, ito po yung second dose nyo, para parang pakyawan ng dating. Hindi ka per patient kasi it's a public health program. It's not geared towards a certain patient lang. So ang mangyayari po is that kunyari yung first dose, it's a cohort, it's a group. Nagkaroon ng first dose, kunyari April 7, then after 28 days, if ma-delay po yung supply, they'll try to have a backup solution on when is their second dose. And then it's another group. Okay? So you have to check with your physician or with the recommendations po on when you will get your second dose.
Pero
Wag niyo po
hindi ba napapaso? I think yun yung question, no?
Napapaso.
Hindi ba
Yes,
mapapaso
ma'am.
yung first dose? Kasi kaantay
We're
mo
not
dun sa
sure po.
second dose. Baka mamaya, wa-effect na yung first dose. Nangyayari
Yes,
mo
ma'am.
ba yun?
Hindi po natin alam at this point in time. There are several studies po that's being done to try to answer this question, especially as supply constraints are becoming a big problem. So we have to look on our experts, specifically the NITAG or the doctor that's closest to you, the one that's helping you with your decision making. So lagi lang pong keep your, yes ma'am. So lagi lang pong be ready to get your second dose if you got the first dose already, and be ready to get your first dose if you haven't gotten your first dose yet. So for example po, on a personal note, ang hirap po, for example, yung nanay ko, she's a senior citizen. So yung tatay ko nakakuha na ng first dose. So yung nanay ko medyo vaccine hesitant. Ang problema, nung na-convince na namin siya na magpa-vaccine siya, wala nang supply. So it's a missed opportunity. So when it becomes available to you, get the vaccine, and then on the second dose, try to check and see with the recommendations from our expert groups in the Philippines or with your doctor on when is your second dose, and try to follow that schedule. Kasi nga po, konti po yung supply.
Okay. Ang tanong, Dr. John D., ito, baka masagot mo. Ito naman ngayon ang tanong dyan. May mga nagsasabi na kung first dose lang ang nakuha mo at hindi mo sinundan ng second dose, para ka na ring walang bakuna. Totoo ba yun? Ay, nakamute ka, Dr. John D. Dr.
Nag-mute ako, ma'am, pagka hindi ko alam ang sagot eh. Pero
Pero ngayon naisip mo na. Okay.
kaya ako sinasabi, hindi pa ho ganun kasigurado ho eh. Kasi chinecheck nga ho kung ano yung antibody levels before and after vaccination and what will be the ideal gap. Ang dinadasal nga namin, baka hindi na nga kailangan ng second eh. Kasi pag ang lumalabas yung antibodies ay ang taas na pala at acceptable after the first, pwede nang hindi na magkaroon ng second. Pero that's my long way of saying na hindi pa natin ho alam, kaya ang rinirekomenda nila, depende sa bakuna, after 4 weeks at after 8 weeks, magpa-bakuna uli ho kayo. Habang ginagawa natin yan, maiipon natin ang datos at informasyon, masasabi sa susunod na, napag-aralan na po, ganito pala nangyayari. So, pwedeng mabago po.
Okay. Dr. Ted, kasi nga meron pang mga suggestions ngayon na bakit daw hindi na lang muna bakunahan ang mga taga-NCR dahil narito naman yung epicenter, no? And kulang pa rin naman yung supply. So imbis na yung second dose ng mga nasa regions, gamitin doon as second dose. But hindi na lang daw muna first dose dito. Is that a logical solution, you think?
Yes, your wish is my command. And in fact, yan ang plano ng National Vaccine Operations Center. Dumating recently yung 1 million doses, no, of Sinovac, and half of it, 500,000, will be distributed dito sa Metro Manila. So we're trying to get to the ground zero, no? Very important na yun ang ma-address natin because we have a surge or an outbreak happening in Metropolitan NCR+. So dito talaga i-disseminate yung mas maraming bakuna. Anyway, yung status naman sa ibang lugar, mababa yung new cases. So they can actually wait. So yun.
Pero hindi rin it's not wise to say na wag na lang muna ako magpabakuna hindi pa naman pala available yung second dose, useless din naman pag isang dose. That's not true.
For those that got vaccinated with the first arrival, in-store nila yung second dose, especially for Sinovac. For Sinovac, the instructions to the vaccination center is, meron kang doktor, 100 doktor, binakunahan mo with the first dose. Yung second dose nila, nando doon sa kanilang cold storage.
Nakareserba na. Yes.
4 weeks lang eh. Ang instruction na ibigay lahat yung first dose was AstraZeneca. Kasi itong WHO, nag-donate sila Pero yung dinonate nila kasi mag-i-expire na sa May 31.
So, kailangan gamitin na, no? Yes.
So pagka yung mga dose na second dose ng ibang senior, dahil 12 weeks, after May na, expired na yung bakuna. So ang decision ng National Vaccine Operations Center ay sige, ibigay na yan sa lahat ng mga senior. Ayun, naubos yung 525,600 doses nila na ibigay na natin sa mga doktor at mga senior. Ang promise kasi na magdi-deliver sila ng 929,000 doses nitong April. Pero na
ano nga
yung mga
delay.
Talagang ayaw nilang bitawan yung kanilang supply. Sabi, binayaran namin yan. Unahin nyo kami. Itong COVAX, donations ito Donations po ng mga mayayamang bansa. Yung parting sobra nila, ibinibigay nila doon sa COVAX facility na ang COVAX naman ibinibigay sa mga low and middle income countries. Kaya tayo nagkaroon kaagad. They're giving us 44 million doses. That's 20% of our population. Yan ang commitment ng nila Dayanghirang. Siguraduhin mo makarating lahat yun, ha? You know, ha?
Okay, Dr. John D, eto mga I'm sure dami mong mga ganitong tanong sa show mo. Yung may osteoporosis daw, yung may allergy sa gamot na tramadol. Yung may yung abnormal na BP daw at may maintenance na amlodipine becylate 3 milligrams. Yung mga ganun po ba, Dr. John D, safe ba na magpabakuna yung mga yan?
Okay, baka ako batukan ng boss ko sa UP, si Dr. Ted. Kaya lang sasabihin ko na, opo, pabakuna ho kayo. Pero sinasabi ko lang yan dahil sigurado ako na bago bakunahan, i-examine ho siya at i-screen. So kahit meron kang allergy, kahit meron kang osteoporosis, kahit ano pa man ang kinakatakutan mo, pagdating mo sa kung saan ang bakunahan, titingnan ka pa rin. At ang gagawin lang naman, kadalasan sa nakikita ko, kung meron kang allergy, halimbawa, imbis na yung walang allergy, pauuwin after 30 minutes, ikaw na may allergy ka, babantayan ka pa namin na mga siguro 1 oras o mahigit para sigurado na hindi masama ang epekto ng bakuna sa inyo. So sa madalit salita po, kahit ano pa man ang sakit ninyo, maganda pa rin ang proteksyon ng bakuna.
Okay, ito pahabol pa, Dr. John D. from Agnes Velasco. Can minors 17 years old and below, be given the vaccine?
Kung Amerikano kayo, opo.
Bakit? Ba't may racial discrimination?
Sa Amerika po, sinimulan na nila kasi i-testing. Dati, gaya sila natin na ang binibigyan lang 18 and above. Tapos after 2 weeks or 1 month, binigyan na nila yung 15 to 17. Tapos yung
pero dito,
test. Tayo po, wala pang datos at wala pang ganong impormasyon. Kaya mag-aalangan po ako na mambola ka na palitan mong birth certificate mo para lang mabakuna.
Naku, binigyan mo pa ng idea. Salamat. Lagot ka. Dr. Ted, yun nga. I think ang question din ng marami ay pag nagpupunta nga naman sa LGU kasi, nagparehistro na sila online, Dr. Ted. Pero pagdating nila doon, yung doktor na nandun, sasabihin, kailangan nyo munang magpa-consult doon sa physician ninyo. So parang nasasayang yung trip nila. So what do you recommend? Should they first go to their doctors, their physicians before they register? Ano ba dapat ang mas efficient na paraan?
The help of you guys in the communications industry to bring out the message. You register, and most of the cities sa Metro Manila ay magre-register ka online. Pero dahil sinasama na natin ng senior citizen at siyempre yung senior citizen may ibang sakit yun. And persons with comorbidities below 59 pero may high blood, may diabetes, may respiratory disease. Ang hinihingi ng local government health offices ay medical certificate, parang copy ng iyong diagnostic test, previous reseta, and itong nakakalimutan, clearance from your doctor na pwede kang bakunahan. Now, hindi na i-communicate yon. So, madami kong horror story na pumila na sila,
Yes.
na pagkatapos may isang tao from the office, from the health office, iikot, o asan ang inyong papeles? Wala kang papeles, alis ka muna. Pinaalis sa linya at pinakukuha yung ano. I think that was a breakdown of communication of what you need. So medyo hindi maganda yung comms noon. So we've learned from that. Dapat i-disseminate talaga sa all the people that if you are person with comorbidity, dala mo any of those. The clearance from your doctor na pwede kang bakunahan, yung reseta mo na anong gamot iniinom mo, proof na, or a diagnostic test like an x-ray na yung meron kang emphysema talaga sa baga mo or something. All of those proof na ikaw ay person with morbidity.
Ano yun? Any or all? Any or all?
Merong listahan.
Any. Okay.
I'll list you the first 4. Chronic respiratory disease. So ito yung may mga asthma, cor pulmonale. Pangalawa is hypertension. Actually, obesity, kasali. Hypertension, obesity, diabetes, ano pa ba yung mga ibang kidney disease. So yan yung mga nakalistan 5 na doon sa.
Yung mga immunosuppressed, immunocompromised like lupus, yung mga may autoimmune disease.
Ang recommendation ko lagi at marami nagtatanong dito sa ating Q&A box, sinasabi ko it is best to discuss it with your physician. Kasi your personal physician will analyze the situation for you on a case-to-case basis. Risk-benefit analysis with your physician. So you're kidney transplant ka na or naka-dialysis ka, naka-immunosuppression ka for blood disease, mag-usap kayo ng physician nyo. Kasi your physician will give you advice on the risk. Kasi remember, yung bakuna, magpuproduce yun ng illness and we don't want that risk to be higher. So kayo mag-uusap niyan. And then, gagawa yan ng recommendations at pag nabasa yon sa assessment, mas hahabaan nila yung observation period mo after vaccination para pag-ingatan na talagang hindi ka magkaroon ng adverse event or hindi ka mamatay.
Okay. So babakunahan pa rin. Pwede pa rin naman. Kaya lang baka kailangang i-monitor. Ganon.
Yes. At baka may event, may adverse event na hindi naman ka mamatay pero baka ma-hospital ka or baka magstay ka sa emergency room ng ilang hours.
Right. Okay, there's a question here addressed to actually the MVP group na sinagot din, no? But for the benefit of those listening now or tuned in now, the question was this. The Philippine government declares that the COVID vaccines are free. How then does the MVP group, as well as other private companies, charge the relatives and kasambahays and have their employees and legitimate dependents free of charge only, no? Ang sagot naman ni JM ko dito sa tanong na ito ay we are providing our vaccines for free to our employees. As for dependents and household members, we are providing access to vaccines at cost. In other words, babayaran yes, pero walang patong. Okay, hindi pinagkakakitaan. However, and this is important, they are free to avail of free vaccines through their LGUs. So, tama po yun. So, yung mga empleyado po ay libre, pero yung mga household help or mga ibang dependents, pwedeng sa LGU na lang iparegister or kung gusto nyo sa MVP group din, pero babayaran nyo yung vaccines at cost.
Can I clarify this?
Yes, Dr. Ted. Yes, please.
So, ang mga bakuna po, di ba sabi ko kanina, experimental. At ang binigay sa kanilang registration ng ating Food and Drug Administration ay EUA or Emergency Use Authorization. Pwedeng gamitin ng government, pwedeng gamitin ng national government dahil may pandemya at may emergency. So yan ang authorization niya. Bawal pa siyang ibenta. Ano yung benta? Dapat kasi meron ka ng Certificate of Product Registration. Yung CPR, binibigay lang yon kung tapos na yung phase 3 trial. Dahil hindi pa tapos, none of the vaccines are for sale. Pero very ingenious ang mga Pilipino, nakaisip ng tripartite agreement at pumayag yung AstraZeneca. Sila yung unang pumayag sa ganito. So, inallow ng government ang private company like Metro Pacific to buy with the permission of the national government to purchase on the condition that they will follow two things. Number one, they will follow the prioritization of NITAG. So kung may health workers kayo sa Metro Pacific Group, unahin niyo muna yung senior, unahin niyo. Kasi hindi dapat mag-compete sa national prioritization. Number two, no one should profit from the vaccine. So yan, kagaya ng sinabi mo, the rule is pwede mong bayaran yung bakuna na binili ng company ng Metro Pacific para sa iyong dependent, spouse and children na hindi naman nagtatrabaho sa corporation, pero at the cost, hindi magpo-profit ang corp. Because if you profit, it's now considered a sale. So that's a violation of the tripartite. Pahihinto po kayo ng gobyerno. Matitigil yung
So, yes.
So kailangan ito, no? Sa mga dependents nyo, it is a social entrepreneurship. This is not a for-profit endeavor. The vaccines are for a social good, and Metro Pacific is just helping the government make sure that everybody gets their vaccine. So they can collect your money para yung pamilya nyo mabigyan na kasi baka mas matagal yung ano. Pero that will not stop you from lining up also in the vaccines for the LGU where you are living or working.
Yeah. At yan din po ang dahilan kung bakit hindi pinapayagan ang mga private sector na dumiretso, di ba ho, sa mga vaccine manufacturers at bumili ng sarili nilang vaccines. Tama ho ba ako, Dr.
Ayaw naman magbenta ng mga vaccine company sa private companies kasi maliit na order lang yan. They will only talk to national governments, to federal governments and national governments. Kasi mas gusto nilang kita yung bilyon kesa sa order ng 6,000 doses.
Well, kasi Doc, yung Philippine Chamber of Commerce, kausap na nila yung yung Covovax, yung sa India.
Yes.
Yeah, na pwede raw sila bigyan. Kaya lang di nga sila pinapayagan ng gobyerno.
Pinapayagan na
kailangan pa rin tripartite. Pumayag na?
Hindi, pumayag na ang president na allow the private sector to buy as much as they want. Pero kinlarify naman the policy.
Pero tripartite, yeah, pa rin.
Sa tripartite agreement pa rin.
Right.
So yun yung mechanism natin. No? We have a mechanism for private sector to consolidate. So ang nakikita ko, there are groups now that consolidate. So may group na nagko-consolidate for Moderna, for Astra, for Novavax. And they consolidate the orders, isasabay nila yan sa order ng national government. Kasi tayong national government, we bought on a portfolio. 7 vaccine manufacturer ang kinausap ng Philippines government. At lahat may supply agreement tayo doon. Yung private company na may napiling bakuna, parang ipipiggyback niya yung bilin niya. So, Moderna, bumili tayo ng 13 million doses of Moderna, national government. Yung private sector na consolidator nito, nakaipon siya ng 7 million doses. Kasama kayo doon. I think doon kayo kasama. Sumabay kayo doon. So we have an outstanding order to supply us 20 million doses from Moderna in the US.
Okay. Thank you, Dr. Ted. Dr. Dayanghirang, we have a question for you because alam po namin na yung gobyerno ay gusto makamit na natin ang herd immunity or 70% of the population. Sana raw by the end of the year, no? Sana nga raw yun ang Christmas gift sa mga Pinoy. Pero sa nalalaman niyo po, at the rate, there's so much hoarding going on among the rich and wealthy countries for these vaccines. Ano po kaya, how does the commitment of these manufacturers look right now? Will those vaccines purchased come on schedule by the third quarter. Kasi yung private sector vaccines, alam namin sa news na third quarter daw yan darating. And then the rest of it for the last quarter of the year until December. No? Ano po ang chances na despite this really bad experience we're having to go through now with AstraZeneca, no, na na-delay na naman, na masusunod po yung timetable na yan?
Thanks, Miss Luchi, po dun sa question. Ayan po yung pag-meetingan namin after this meeting. Yung supply issues nga regarding dun sa manufacturer. Yes. But there's a commitment. Lagi naman po may commitment, and we're trying to push governments naman po talaga to make sure that we ascribe to equitable distribution of vaccines. That we, katulad po na sinabi ni Dr. Ted kanina, there's a prioritization of who should get it first, for example, healthcare workers or the people most at risk, and to make sure that everybody ascribes to that prioritization, because as hindi po ano yun tawag dito, hindi po nirespeto ng COVID-19 ang borders ng country. It can perhaps for some reason it can try to be limited by geographical borders, for example in an island, pero yung mga political borders wala pong nirerespeto sa COVID-19. So we will never get the herd immunity that we want globally or even at a specific location without first getting a good coverage of the people most at risk, the people who need it first, through our prioritization. So that's what we're trying to do. And if I remember correctly, last week we had this declaration from a lot of our governments who are member states of the World Health Organization that they're wanting to push this, that they realize that this is the best way to do it, na lahat mabigyan, na hindi lang a specific population on a certain political border, but to better control and manage and hopefully defeat this virus at the soonest possible time. It's a concerted effort from everyone.
All right, thank you po. Dr. John, ito na naman, safety questions. Yun po raw Chinese medicine na Lianhua Qingwen, safe po ba yun? At effective daw po ba yun? Sa nalalaman ninyo?
Ma'am, I'll apologize. I've been using Tagalog and marami pala kayong Chinese sa audience at saka foreigners. So I'll shift to English now, our real national language. But the FDA, as has been pointed out, has approved that herbal medicine as a herbal supplement, not as a treatment for COVID-19 in our country.
COVID.
So they may point to what's practiced in other countries, but in our country, that's the official statement po.
Tapos, is it safe for, this is from Monica Villanueva, no? Is it safe for polycythemic and thrombocytosis patients to be vaccinated?
Okay. Sige. I'll connect that to the previously answered issue of thromboembolic or blood clot problems associated with some of the vaccines. And I think the case was observed in Europe, but I'll qualify by pointing out that there were only 30 cases out of 17 million that were vaccinated. So that is going to say that it's relatively safe. Number two, if you compare those who are vaccinated and those who did not get vaccinated, mas mataas pa ho ang blood clotting problems sa mga hindi na bakunahan kaysa sa binakunahan. Kung yun ang numbers, 30 out of 17 million versus the numbers of thromboembolic problems dun sa rest of the population. Safer po ang bakuna.
Okay. Fine. Ito naman, from Metro Pacific Hospital Holdings. Do you think the virus will evolve to children, targeting children, once we reach herd immunity for adults? Mangyayari po ba yun na pagka yung mga adults ay na-immunize na, baka daw tumalon yung virus sa mga bata? Is that possible?
It will evolve and change us all to zombies. No, no. I've watched too many movies. No, but I think the virus,
Aba.
the nature of viruses is that they will always evolve and mutate. In fact, the 1918 virus, the influenza virus, has evolved and mutated, and today there are over 80 strains of the influenza
Yan,
virus.
dami.
So,
And more every year, I think.
vaccine yearly, they just choose, parang nanguhula lang sila doon, intelligent guess of what they will put in the vaccine for the year, which is the most likely probable viruses that will predominate, and that's the shot we get. So we get a southern hemisphere. My bold prediction is to answer that question is that yes, the evolution of the virus will happen, and yes, I think it will become like the flu, the coronavirus. Yung coronavirus kasi already exists and it causes common colds. Ipon.
Oh, yes.
Pag na-immune ka na, okay na. So it's mild. Pero itong variety ng SARS-CoV-2 na nag-cause ng COVID-19, I think will also evolve. Now, the good news is that viruses tend to evolve to a weaker strain than a deadlier strain. Kasi pag pinapatay mo yung, if you're a virus and you kill every host that you enter, in the end,
Wala ka na mapuntahan.
then, di ba,
Yeah.
you become extinct. So the wiser viruses that will evolve is a virus that will be like the flu. Parang yung influenza virus na napakaraming strain, tapos palit-palit lang sila, and then they can infect people who haven't been infected, and they continue to be around. So that's my bold prediction. And yes, this vaccination thing might be a yearly tanong sa Q&A sinasagot ko.
Can I
Yearly.
give bad and good news, Ma'am Luchi?
Sige, Dr. John Lee, go ahead.
The good news is... Pwede din. The good news is because we're so late in vaccinations, the testing for children or younger persons is already being done abroad. So it will not be a far out dream to think that within this year, maybe we already have the data to say that we can already begin vaccinating younger persons.
Even children.
So that's the good part of our misfortune. The bad part is, in fact, children already have become household transmitters. So habang nagbabantay
super spreaders nga raw eh.
Yan. Habang si Lola at Lolo ay nakakulong sa bahay, yung apong bulinggit na labas ng labas, pagbalik sa bahay medyo may dala. Kaya tama ho yung the dream is correct. To prevent children to older persons infecting each other, the vaccination should at the soonest begin to reach younger persons po.
Okay, but are we seeing also that we might end up having to do this nga yearly? And will this be part of the vaccinations that my children actually undergo? Di ba? Merong set of vaccines that children really regularly have to take every year. Di ba? Mapapasama na ba ito doon? Starting now?
Dr. Nino, tanong yan sa mga younger persons. Baka retired na kami ni Dr. Ted pagkadating nun.
Dr. Nino, ano ba yan? Magiging regular vaccine na lang ba yan ng mga tao ngayon?
Future projection.
Yes, Ms. Luchi. Thanks, Doc John D. Tama po yung sinabi ni Doc John D. Doon po sa pagiging yearly ba o yung mga future predictions, nakakatakot nga kung maging zombie lahat ng tao, katulad sa ni Doc Ted. Pero we, at this point in time po, we don't know. We're really hoping po for the best with this current program for vaccination, that it's going to be the best intervention right now. So in order for us really po to have action on a personal level, is that we still continue po with the current trend of social distancing, frequent hand hygiene, keeping yourself healthy, so that yung mga mutations po na nangyayari, yung mutations po kasi mangyayari yan eh. Ngayon, ang gusto lang po natin mangyari is that mapababa po yung possibility, mapababa po yung rate ng mutation. So sa pamamagitan po ng pagbaba nito, malilesen din po yung risk of it being even more virulent or even more nagkukos po ng disease or nagiging mas nakakahawa. So sa atin po dapat, we try to limit po yung infection kasi sa infection po, doon po nangyaring mutation o yung evolution ng nung virus. So kapag napababa natin infection, hopefully this will be enough to hopefully eliminate it as a public health problem and hopefully towards eradication as well. But we have to remain vigilant that as we can see with the current health system that we have right now, hindi po tayo prepared enough. So we're trying to respond as best as we can, and we can do it at a personal level, at a family level, at a community level. We have to always do our part to make sure it doesn't mutate into something that's even more difficult to manage that more than what we have right now.
And Luchi, kung lahat ng mga Pacific ay magdadasal, baka mangyari sa kanya ay kagaya nung sa SARS na una. Nag-disappear na lang. The first SARS, SARS that went to Vietnam.
I remember that.
That means the virus eventually died out and cannot infect anymore. Sana magdasal tayo na ganun din ang mangyari dito sa SARS-CoV.
Sana nga. Yes. Last question na lang before we close. No? Is vaccination safe for pregnant or breastfeeding mothers? Yan. Dr. Ted, sagutin mo na yan.
Well,
one for the road.
The US and Europe, they have been given to pregnant but on the 3rd trimester. Alam ko, inallow ng ibang obstetrician yung, kasi pag 3rd trimester ka na, yung last 3 months of your pregnancy, fully formed na yung fetus mo. Remember, the fear of new drugs is that they can cause genetic or congenital anomaly. Naalan yung thalidomide noon and everything. So yan ang problema.
Yes.
Not unknown yan.
Right.
Kasi none of the experimental studies were pregnant. So again, I would recommend it to be given to 3rd trimester, yung malapit na mga anak. Pero talk with your obstetrician. I think it's also safe. Lino, it's correct, no? For breastfeeding mothers, it's found to be safe. It's also been found to be given to even mothers who are breastfeeding kasi parang it's not transmitted to the breast milk. So safe yung mga anak nyo, hindi sila may-infect nung in-inject na vaccine.
All right. Thank
Yes,
you. Thank you so much.
Yung current information.
Yes. Thank you, Dr. Nino. Okay. For everyone, we're about to close, but before we do, just know that you may continue watching out for further webinars on this series. We Got Your Vac. Yan. And do help us to improve future episodes by answering this quick survey. It's in the chat box, no? So please do refer to that. This is being recorded, so you can actually review it for those of you who might have missed it. And at this point, we'd like to thank, of course, our distinguished guests for taking time to communicate to us the importance of being vaccinated and also observing protocols and being, as we say in Frontline Pilipinas, our primetime newscast, ay dapat maalam at makialam. Yan. Okay. Dr. Nino Dayanghirang, maraming salamat. Dr. John D. Flavier, Dr. Ted Herbosa, thank you very, very, very much. This has been a fruitful webinar for us. Maraming salamat. God bless you. And for all who joined and who pitched in questions, maraming salamat. Thank you also to the organizers, sila Gian Lau, sila Agi, sila JM, kung sino mang mga hindi ko nasingit, pasensya na. Maraming salamat po. Salamat! Thank you. Goodbye and have a good day. God bless.
Thank you, everybody. Dami, walang hindi sila, they never left. The 400.
Oh, right. Yeah.
The
Ngayon pa lang. Yeah, they stayed the whole time. 508. Very good. Yeah. All right. Thank you.
That's good. Thank you, Ma'am Luchi.
Salamat. Salamat, Dr. Ted, Dr. John
Thank you
D,
po.
Dr. Nino. Thank you.
Thank you po, everyone. And thank you for participating dun sa FAQ, sa Q&A. Ang daming tanong, but very good questions. No? So
They're all individual, different questions. Sagutin nyo pa rin.
Yeah.
Pakilan nyo
Yeah.
para sagutin.
We're noting everyone's questions, just for the ones on YouTube, for the ones on Zoom. We're noting everyone's questions. We're going to make sure if we don't get to answer them in an FAQ very soon, we will answer them in the next webinar. We'll do our best to get to everyone.
Get the questions and then yung magkakapareho, gawin yung FAQ, the most common. And then you can discuss the company.
Right.
Yes,
right.
Doc. Great idea.
Okay. Thanks, Gian. Salamat.
Thank you so much. Have a good